Welcome back to the channel. I'm Andrew with Running with Dr. Andrew. Do you have runner's knee? Let me show you a taping technique that'll help you with your runner's knee. All right, let's get running, guys. Let me show you how to tape your knee if you have something called runner's knee. What is runner's knee? It is a condition where your kneecap gets irritated, or you have something called patellofemoral syndrome or patellotendinitis. And so you just get some irritation around your kneecap. And that's just because maybe you have some weak hips or things like that that may contribute to rotation where the knee kind of shifts over to the side. And so what you can do is you can tape your knee in place here. And so what you're going to do, you're going to use something called kinesio tape. So this is this type of tape here. This is actually a Walgreens version of it. So you can get this at Walmart or any type of sporting goods store. There's actually a brand called Kinesio tape that you can get. That's the original brand. Or there's KT tape that you can get. I think it's TheraBand brand. And so what you can do is, so we're going to cut this in two. These are pre-cut already, but I don't need as big of pieces. Cut that in half. Usually if you cut it in half, you want to maybe round the edges. That helps keep the tape on a little bit better. And when you tape your knee, you want to make sure that your knee is bent into that position there. And so we're going to do is kind of a split. Split the tape. So the first one you're going to do is start above the kneecap. This is going to go around the kneecap here. Here. If you do have hair like me, and sometimes if it seems to help out, you can always shave that area there. But it should be okay. So in here, and kind of stretch the tape about 100%, back off to 50%. It's about a 50% stretch here. So I've been doing this tape job for about 12 years or so. And so that kind of goes around the kneecap there. And it seems to kind of help out with patients that do have so you're going to make sure to get the split part above the kneecap there. Helps out with people that have plantar fasciitis, or I'm sorry, patellofemoral syndrome. Tape around it there. It is a little bit harder for you to tape yourself, but that's okay. So that's one piece of tape, so it kind of goes down here. And so you want to rub the tape. Rubbing, this kind of helps activate the glue a little bit better. And so with tape, you just want to make sure you're not putting any direct heat, like a heating pad on top of it, or using a hair dryer or anything like that that can capture into the taping, potentially cause a skin burn. So we definitely don't want that to happen there. So we put the second tape, and so we're going to do the same thing. We're going to split it in half. Call this a Y shape. The reason why you want to keep the knee bent is because you want it to be on stretch when it's bent, because you want your knee to be able to bend properly. So he's going to go down below that first Y strip, come up, 100% stretch, back off to 50% stretch, and then tape. Same thing. Usually the ends of the tape, you want to make sure it doesn't have a stretch on it, so that way it doesn't cause any type of skin breakdown. Again, rub the knee there. Helps out with that. So when you straighten your knee out, your knee is gonna, the tape's gonna kind of wrinkle a little bit, and that's okay. That's exactly what you want the tape to do. So we're gonna do one more piece. And kind of do a circle there, and then we're going to do is cut it in half, split again. So now we're going to go start from inside of the knee, and they're going to pull to the outside, so they're going to get a recoil to pull back inside, because sometimes that kneecap wants to go on the outside, and that's how you get patellofemoral syndrome. So it goes. Again, that goes around the knee there, pull 100%, back off 50%. And those anchors should be on your skin, should not be on the tape, other side of the tape there. Pull and stretch. So it should kind of look like just like that. It feels kind of almost like you have a nice good knee brace on there. And you want to, you know, when you first get it on, kind of do a little bit of some walking around your knee there. Okay, and so then whenever you straighten your knee, this is what it looks like. It kind of really helps support that kneecap there, and helps you, keep that kneecap while you're in position there, while you're running or doing any type of exercises. So definitely a good thing to have. That's kind of what it looks like. It's 2 Ys. There's the 1 Y, that's the other Y, and that's the 3rd Y right there. So 3 Ys to kind of keep that knee in place there. Good kind of tape job there. Has been pretty successful. Like I said, I've been doing that for about 12 years now. And that's not the only thing they can do for plantar fasciitis. At the end of the end screen, I'll put down my latest runner's knee video. And also put down a common running injuries playlist. There's a second, so there's actually 2 runner's knee videos. One's called plantar, another one's called runner's knee. And so that will tell you what type of exercises you can do for this type. This is just for helping out with pain and helping out with something called proprioception, which is where your body knows where your knee is in space. Help out with the balance with that, and that can sometimes help out with your knee pain while you're running. And so this ends this video of taping your knee. Let me know if you've tried this before. Let me know in the comments and see how it goes. And if you have not subscribed to this channel, please hit subscribe and ding that bell so you don't miss any other videos. So I hope everyone keep safe, keep running, and we'll see you next time.